Good. Good. Hey everybody, it's Dr. Tyler at Sioux Center Chiropractic, and today I'm here with Maccay. Maccay is a college volleyball player, and we've been seeing her the last couple visits for some heel pain and for some lower back pain. So Maccay, kind of give us a little bit of a lowdown on kind of what brought you in and how it's been affecting you.
Yeah, so playing volleyball every day, there's just different aches and pains, and about a week ago I kind of felt some pain in my heel. And it kind of just gradually got worse, so I just thought I would come in and see Dr. Tyler.
Cool. So she's playing a lot of volleyball right now. The season, we're getting into conference tournament play and then eventually national tournament here coming up. So today we're just going to go through a quick assessment. We've already been working with her, so we know what we're dealing with. So we'll watch a couple ranges of motion, feel the joints, and then we'll get started with our treatment. You're not going to see it in the video today, but we are also doing some rehab with her out in the gym space, as well as a little bit of laser therapy. So today we're just going to go ahead and do some soft tissue and manipulation, and we'll get started with just watching you move here, Maccay. So I'm going to have you start by standing here, and we're just going to check your flexion first. So you're going to go feet together all the way, and then you're going to look down, try to touch your toes, come back up. All right, and I'm going to have you face this way and keep your feet together, hold your arms out, and you're just going to do a squat for me as low as you can. And back up, and one more. Good, and now hold it at the bottom. So like on Maccay, you can see she goes forward a little bit with the upper part of her torso. And that's just showing us that she's got a little bit of a lack of flexion in that ankle. So that's something we've been working with her. You can come back up. That's a common compensatory mechanism we'll see is that we'll dump everything on the top half of our body forward if we're not getting that mobility in the lower extremity, in her case particularly the ankle. And we'll see that a lot with like plantar fascia cases or heel pain cases where that tissue is trying to make up for that lack of mobility in the ankle. And you can work the tissue. We're going to do that today, but we are going to be working on mobilizing that ankle, because at the end of the day, if that's not moving, this thing's just going to keep rearing its head. So we want to treat function over pain. We care about pain, but we're going to just take a look at that ankle. I'm going to have you go ahead and lay on your stomach first, and then we'll check both ankles. I'm going to go ahead and bend the foot up, and then we're just gonna flex here. Is that painful or tight?
Nope.
And then we'll do the other one. Painful or tight?
A little, yeah.
Yeah. Where do you feel that?
Kind of through my arch.
Through the arch. She's got similar restriction on both, but definitely a little bit more pain on this side. Maccay, I'm gonna have you lay on your back now. And we're just going to feel the joints and do a little bit more assessment in the foot. I'm just going to be here. So I'm feeling for how much spring there is at the end of the joint. She's already getting a little clicking in here. All right. And Maccay also has a history of some calf and kind of shin discomfort from back in track, correct?
Yep.
And so that's something that always comes up, and I like to address those tissues also when we're working on any type of foot and ankle. So I'm going to just start with just doing a little bit of active stretching over the tibialis anterior. And Maccay, you're just going to bring that foot and ankle up, and then we're going to start in this position, and you're going to go all the way down and in, and you're just going to feel tension under my thumb, okay? So I'm going to start a little higher up, right through here, and then you go ahead and point it all the way down. Good, hand up. You guys played tonight, correct? Or
we played last night at Briarcliff.
Briarcliff last night. And then how'd that go? Give us a lowdown of the game.
Yep, so we won in 3 last night. Important win because we got to be co-champs of the conference. So
sweet.
Kind of nice because we got the 1 seed, so we're at home for the rest of our games. which is a big plus.
Yeah, home court advantage, and then nationals would be in Sioux City.
Yep.
Correct? You guys know who you got first round?
No, we'll find that out in about 2 weeks, I'm guessing.
2 weeks?
Yep.
Yeah, it's hard to believe that volleyball season is coming close to an end. State championships going on for the high school right now. Mackay's alma mater got a victory yesterday, so they advanced into the semifinals. I should say Maddie's alma mater too, and Carson's alma mater. So it's fun to watch the local teams do well down at the state tournament. So everybody puts a lot of work. All the local teams put a lot of work in. Yeah, it's good to see that pay off. Feeling any stiffness with this, or not too bad?
A little bit, but not terrible.
Now I'm just gonna work in more of the inside of her shin, or the tibialis posterior. We're just using that ankle motion to help stretch the muscle. So that's actually the opposite direction of what we were doing with tibialis anterior. Good. All right, while I got her here, I'm gonna take your sock off, and then we're just gonna do a little bit of instrument-assisted soft tissue work in the arch of the foot going into the heel. And Maddie, come over here. So we're just going to put our emollient on the foot first, just so we're not scraping directly on the tissue. And we'll start slow. You okay here?
Yep.
Sometimes it's a little ticklish when we're working the plantar fascia, but what I'm feeling in here, and you can kind of even maybe pick it up on the mic.
What?
You can kind of pick this sound up on the mic a little bit.
Oh.
Is you can feel how kind of pebbly or grindy that is. Do you feel that with
a little
the
bit,
scraper? Yeah. And that's just the fascia that we're picking up. And a lot of times when that's being overused, it'll feel like really gristly. And the tool actually helps pick that up. It amplifies it, so we know if we're in the right area or not. Doing okay?
Yep.
So I'm just working up all the tendons of the arch. And these tendons they connect into that heel. So a lot of times when these are overused or they're being worked too much, the muscles will be tight. And where they insert into the arch, the muscles and tendons are really tight, and they're pulling on that bony attachment. And that's where a lot of patients will come in and present with that heel pain. Is that kind of where you've been feeling it?
Yeah.
All right, okay. We're going to go ahead and do a couple adjustments on the ankle first.
Okay.
So I'm going to be right through here. And you're just going to kind of feel a little pull here, okay?
Okay.
And again. Good. And through there. I'm going to go grab the speaker board real quick. All right, okay, I'm going to actually have you sit for this next part and slide back just a tick. We're going to use the speeder board to get a little more mobility in that ankle. So we're going to bend the knee up right through there. And this is just a device that we like to use on extremities, so in her case the ankle, and we're just going to basically be thrusting through the joint where we found that restriction, and then the board's going to give out and just help us get that mobilization that we need. So you just relax here and you're just going to feel a light thrust. Good. And that internal tibial rotation isn't quite where I want it, so I'm going to actually take her into that and thrust. Good. And again. Good. That feel okay?
Yep.
Now, I'm going to actually sit here and kind of bring your leg around and then bend the knee out a little bit like that. And we're going to be on the actual heel itself,
Okay.
the calcaneus. And this one, I'm just going to kind of like hit it right on there, okay?
Yep.
Good. Okay, come back. And just let that all relax. Gotcha. That feel okay?
Yep.
Good. All right, let's go on your stomach. I'm going to just work a little bit of the calf, and then we'll assess the spine, get that adjusted, and recheck your range of motion. All right, so now to get the gastroc and the soleus, I'm going to have you start here, and then you're going to bring the foot and ankle up, and you're going to feel that pull as you do that, okay?
Okay.
Right here, all the way up. Go for it. Point, and up. Point. Good. And again. You guys aren't only, you're not only the 1 seed in the conference right now, aren't you, in the country?
Yeah, it's kind of crazy, but yeah, pretty exciting.
Yeah?
It's kind of cool. Our football team is also the 1 seed, so kind of cool to have that same
That's the first time
rating
that's
at the
ever
school.
happened, right?
Yeah.
It's the first time in school history. Northwestern College. Double number 1 rankings. It's pretty cool. Feel that pretty good?
Yeah.
There we go. One more. Okay, and I'm just going to bring you up here, and you just let that relax. How's that feel going into the arch now when we're doing that?
Still a little pain, but a little better.
Right through here?
Yeah.
All right. Do one more. I'm going to have you lay on your back. But we're going to start with the foot and ankle up. And I want you to curl your toes while your ankle is up to here. So bring it all the way up, curl the toes. And I'm going to be right down here. You're going to point the foot and ankle down. And then you're going to flare the toes out while keeping that foot pointed down. Okay? It's kind of a different move. So we'll start here, curl everything. I'm going to be right there. And go ahead, point. Flare it out. Feel a pull there.
Yeah.
Point. Hold up. Okay, now go. Flare them out. Good. One more. Point. Flare them out. Good. All right. Okay, go ahead and sit on the end, Mackay. And I'm going to sit behind you. There. Little tender right through there.
Yeah.
Just got a little bit at L4, L5, a little bit on the right SI joint. Okay, so I'm gonna have you start by laying on this shoulder, Mackay. Face me. And then we're gonna bring this top knee up, okay? Right through here. And then slide up a little more. And we'll go right like that. Perfect. All right. So you're just gonna take a deep breath, let it go. Good. Other way. And we'll do this side, knee up. A little bit forward. There we go. Right here. Let it go. Good. On your stomach. And we'll get the SI joint. We're going to do a little drop on that. And we're about done. Got a little tender?
Yeah.
Right there. All right, you're gonna feel this kick on. There we go. One more. Good. And she's just got a little bit here in this thoracolumbar region, so Mackay, I'm gonna have you take a deep breath, let it go. And then lift your head up. Hold your breath. Good. Come back up. All right. And we'll sit on the very end of the table and just recheck the pelvis and we'll be good to go. I feel okay in there?
Yep.
Good. All right. Sweet. So, that feel okay?
Yeah.
Go ahead and we're going to go out and do some rehab next, do a little bit of laser after that, and hopefully Mackay's feeling a lot better. We'll continue working with her, getting her through the rest of the season, and hopefully do a successful national championship run here. So thank you for watching. If you like what we're showing you, please subscribe to our YouTube page and have a great day.